Good evening, dear listeners. I hope everyone is feeling well. Today we will talk about an interesting topic, noticing that many are experiencing an increase in blood pressure. This situation brings to our attention the importance of discussing hypertension, a serious medical condition recognized and classified as such by the World Health Organization. It concerns conditions of the cardiovascular system, and as you already know, it is associated with elevated blood pressure. Specifically, hypertension is diagnosed when the systolic blood pressure exceeds 140 millimeters of mercury and the diastolic blood pressure is 90 millimeters of mercury or higher. This means that essentially, a reading of 140/90 is already a reason to evaluate a patient at least 3 times consecutively by a doctor. Usually, blood pressure measurement involves taking 3 readings at different times, considering that the patient hasn't taken any medications that could affect blood pressure. In other words, when you go to the doctor, it is usually advised not to take those medications unless specified otherwise, but if someone in your family has hypertension and has been prescribed those medications, then you should take them, go to the doctor, and have your blood pressure evaluated in a normal and natural state. To receive this diagnosis, you will need to visit a doctor multiple times, and many people fail to establish a timely diagnosis in this way. I can tell you that individuals who have only a 30-unit increase in blood pressure are promptly diagnosed. If we talk about the prevalence of this pathology among the population, approximately 20 to 30% of the adult population suffers from it, and this percentage increases to 50 to 65% in people aged over 65 years. In other words, we understand that age-related changes are already considered here, especially changes in the vascular walls, and individuals over the age of 50 present a completely different percentage. Practically, we understand that there is a significant age difference, called isolated or systolic hypertension, meaning that the upper blood pressure can be elevated while the lower one remains within normal limits. This isolated systolic hypertension is rare in people under the age of about 50, affecting almost 5% of the population on average. At the age of 50, hypertension is more commonly seen in men, but after the age of 50, it more frequently affects women. And it is clear what happens when we talk about forms of hypertension. Approximately 70 to 80% of cases are mild to moderate, while in other cases, symptoms are more pronounced or even severe, sometimes referred to as malignant hypertension. Among other aspects, if we consider the causes that can trigger secondary hypertension, these represent approximately 5 to 10% of cases. The remaining cases may progress to hypertension. And I reiterate, practically, based on data collected from various providers, doctors report that only 30 to 35% of patients are diagnosed with hypertension. This means we should never self-diagnose. We must understand that to receive this diagnosis, we must already have this specific condition, not just a temporary and transient increase in blood pressure. In the case of a temporary increase in blood pressure, it may occur during physical exertion, stress, or in other situations where the cardiovascular system adapts. In the case of a person with hypertension, we observe a constant increase in blood pressure, which is not transient or periodic but persistent in our vessels. Of course, the most characteristic symptom associated with hypertension, as you can see on the slide, is primarily headache, shortness of breath, chest pain, and a pulsating sensation in the temples. You may notice that somewhere around the temples, you feel the pulsation directly in the blood vessels, especially those in the brain. Sometimes, individuals with hypertension may experience pulsating pains in the temples and neck area, and these symptoms help them realize that their blood pressure has increased and they need to check it, see what dosage of medication to take, and so on. Without treatment, hypertension becomes a chronic condition and can lead to severe complications, affecting the heart, kidneys, brain, and other organs. It is important to understand that hypertension does not go away on its own and requires constant monitoring of blood pressure. The most serious concern is not a sudden and temporary increase in blood pressure but persistent hypertension, which can cause organ damage and serious complications such as blindness, heart attack, stroke, heart and kidney failure. Essentially, blood pressure is determined by the circulation of blood through the blood vessels, and during the contraction of the heart, there is a massive release under high pressure, causing an increase in systolic pressure. Upon relaxation of the heart, blood pressure decreases, and this indicator, diastolic pressure, is always taken into consideration in evaluating the state of blood pressure. Here, We must understand that the condition of the blood vessels is an important factor influencing the manifestation of our hypertension, including hypertensive crises. The more affected the vessels are, the more the heart changes and the more the load on the heart muscle increases, worsening the prognosis and impact on other organs, which we discuss in this presentation. First and foremost, I must emphasize the causes that can trigger the development of arterial hypertension, or as we call it, hypertension. Although hypertension is treated by neurologists and other specialists, it is primarily managed by cardiologists. Cardiologists distinguish between primary hypertension, or essential hypertension, which is identified in most cases during the patient's examination through repeated blood pressure measurements, and secondary hypertension, which occurs as a complication of other conditions, including the conditions of many internal organs, which over time lead to the development of secondary hypertension through the involvement of blood vessels. I mentioned earlier that the health of every organ and tissue in the human body is closely linked to the condition of our blood vessels. Factors contributing to the development of hypertensive disease are primarily related to obesity. Think about how much pressure we need to exert on the blood vessels to overcome the surrounding fat, which practically prevents the muscle from contracting and compressing blood circulation, essential components for our blood flow. In addition to obesity, chronic stress is also a significant factor, as we live in a society characterized by continuous stress. Genetic inheritance also plays a significant role, as the mechanisms for regulating blood pressure, such as the endocrine and nervous systems, are often influenced by genetic predispositions. Usually, these aspects lead to persistent hypertension. Furthermore, we understand that our unhealthy habits, including improper diet and lifestyle, are the main causes of atherosclerosis of our blood vessels. In other words, an inadequate diet and harmful habits contribute to narrowing blood vessels and disrupting cardiovascular function during hormonal changes. We discuss different factors, and we still manage our own lives, our dietary choices, our level of physical activity, and the tendency towards obesity, all of which contribute to the development of arterial hypertension. Ultimately, some notice increases in blood pressure at ages 40 or 50, and others even younger. In addition to these basic factors, there are other reasons for the development of hypertensive disease. These include kidney and adrenal gland conditions, as blood pressure regulation is closely related to hormones and biologically active substances produced by these organs. Understand that structural and functional disorders of these organs can contribute to the development of secondary hypertension, especially in the context of conditions such as chronic and acute glomerulonephritis, tumor processes of the adrenal glands, and other pathologies associated with these organs. Second only to kidney and adrenal gland conditions are thyroid gland diseases, as the thyroid gland secretes hormones essential for regulating the body's vital processes, including those related to the vascular system. Understand that blood vessels are responsible for supplying biologically active substances necessary for maintaining homeostasis within the body. Metabolic and blood disorders such as diabetes, hyperlipidemia, and atherosclerosis are also contributing factors to the development of arterial hypertension. Chronic infections, inflammatory diseases, and genetic factors related to vascular dysfunction are a group of congenital anomalies that can contribute to the development of malignant hypertension, as well as to pathologies of the female and reproductive systems, which are complicated by hormonal imbalance. In older women, after menopause, many notice sudden increases in blood pressure, a phenomenon related to hormonal imbalance that influences blood circulation and the maintenance of the tone and elasticity of blood vessels, as well as their ability to contract under specific rheological conditions. Clearly, we understand that the organs and risk groups for hypertensive disease are primarily the heart, brain, kidneys, and blood vessels. Although eye involvement is noted secondarily, it is important to understand that the heart is the first organ affected by arterial hypertension. The heart condition resulting from arterial hypertension primarily manifests through left ventricular hypertrophy, as it is the left ventricle that pumps blood into the aorta, the main part of the circulatory system. The increase in blood pressure in the left ventricle initially compensates for the speed of blood flow and pressure in the large vessels, but in the case of persistent elevation, dilation, expansion, and thickening of the heart occur up to certain limits. However, the heart wall cannot continuously thicken because there is no regeneration of cardiac muscle cells, they hypertrophy but cannot continue to grow indefinitely. Eventually, they begin to die, leading to thinning of the heart wall and a decrease in vital signs, such as pulse or heart contraction frequency. This can lead to the heart muscle's inability to contract normally, with heart contraction frequency decreasing almost completely, signifying oxygen deficiency, a very problematic condition. It becomes extremely difficult to find medications that relax and stretch the cardiac muscle at an appropriate rate so that all organs and tissues receive the necessary oxygen and nutrients. We are already facing a delicate situation. In other words, if they do not respond to proper treatment, this becomes an unfavorable prognostic sign for patients' lifespan. Evidently, left ventricular hypertrophy is often accompanied by the onset of chest pain, known as angina pectoris, which can lead to ischemic heart disease, myocardial infarction, heart failure, and even sudden cardiac death. Also, when our vessels are affected, atherosclerosis or narrowing of the blood vessels in the brain occurs. In addition to atherosclerosis, dietary disorders and cholesterol circulation contribute to an increased tendency for blood clot formation. Damage to blood vessels in the brain most often leads to thrombosis or hemorrhage, manifested as hypertensive encephalopathy and other complications. Sometimes, even cerebral lacunae occur, that is, small dilations with foci of bleeding in the kidneys. The impairment of the vascular wall primarily leads to the disturbance of the hematonephric barrier and the primary excretion of proteins in the urine. This manifests primarily in the form of microalbuminuria and proteinuria, and due to this, vascular lesions in the kidneys can progress to chronic renal failure. It must be mentioned that in the case of chronic renal failure, the prognosis is not favorable, as patients end up undergoing hemodialysis, which can even lead to fatal complications due to severe renal lesions. Vessels affected in other organs, especially in the eyes, are involved in the retinal vascularization process. These can lead to various eye lesions, such as retinal detachment in hypertensive patients. Even with surgical interventions, the results are not always positive, as it is essential to restore vessel permeability and tone to prevent complications, including blindness. It is evident that ignoring elevated blood pressure can have serious consequences. In fact, almost 90% of deaths in untreated hypertension patients are due to heart disease. It is crucial to pay attention to and properly treat arterial hypertension to prevent these serious complications. 43% of deaths are caused by heart failure, and 36% are attributed to coronary artery diseases, which are directly related to the heart. Cerebrovascular and renal causes account for an average of 4 to 7% of total deaths, but most deaths occur due to problems related to blood vessels and the heart muscle itself. It is important to understand that when we discuss other diseases and the factors contributing to them, we often come back to the same aspects. More precisely, improper diet, sedentary lifestyle, obesity, and other associated causes largely contribute to the onset of cardiovascular diseases. Approximately 85% of the conditions included in medical nomenclature are based on these factors. Thus, it is crucial to understand that controlling the health of our blood vessels and the heart's ability to pump blood efficiently through both the systemic and pulmonary circulations are essential aspects for maintaining overall health. This applies even in the case of arterial hypertension affecting the pulmonary circulation, which can lead to angina pectoris and other complications that put additional pressure on the kidneys and require proper management and treatment. In the simplest way, taking care of your health involves regular monitoring of blood pressure. It is important to understand that it is not difficult to obtain a blood pressure monitor from the pharmacy and use it to measure your pressure at home. The symptoms we discussed, such as headaches, chest pain, and other signs of hypertensive crisis, should be taken seriously. As for normal blood pressure values, it is acceptable for them to be below 130 for systolic pressure and below 85 for diastolic pressure. Any values above these limits require consultation with a doctor and regular monitoring of blood pressure to establish an accurate diagnosis. Before making any treatment decisions, it's advisable to measure blood pressure 3 times at rest, in different settings, to obtain an accurate recording. It's important to pay attention to routine and conduct measurements under similar conditions to ensure consistent results. Monitoring blood pressure should be a common practice for everyone, but it's essential to also focus on other aspects of our health, such as diet and lifestyle. Regarding nutritional impact, research on our product Actividan has shown that 6-deoxygalactose, the main component of fucoidins, can have significant benefits in various conditions, including hypertension. These studies demonstrate that proper regulation of blood composition and maintenance of vascular health are essential in managing hypertension. We've highlighted the importance of maintaining vascular health and the rheological properties of blood, as well as the essential role of the three-layered structure of the vascular muscle in maintaining optimal blood flow. It's crucial to pay attention to these aspects to prevent complications and maintain cardiovascular health. And of course, when discussing the tendency for thrombus formation, it's essential to mention our product Actividan, which is an indispensable food with healing properties. I can't stress enough that the chemical structure of our 6-deoxygalactose is very similar to that of heparin, a compound produced by our bodies and used in thrombosis treatment. We all know that heparin is administered to prevent blood clot formation, but an excessive amount of heparin can overly thin the blood, initially causing bleeding and subsequently an imbalance between blood clotting and anticoagulation, which can lead to disseminated intravascular coagulation, a dangerous condition. Our Actividan, being absorbed into the bloodstream, regulates the blood flow rate and rheological properties of the blood, preventing blood clot formation. Due to its similarity to heparin, Actividan efficiently acts in preventing thrombus formation, aiding in liquefying and reorganizing them within the blood vessels. Thus, it restores the normal lumen of the vessels and prevents the formation of obstacles for new blood clots. The antithrombotic properties of fucoidins heparin are the result of its chemical structure, and overdosing is not a concern because endogenous cells that produce heparin are normally found in the outer wall of microcirculatory vessels, where blood clots can occur. In larger blood vessels, the wall layer is composed mostly of connective tissue, unlike microcirculatory vessels, where substance exchange, including oxygen and nutrients, occurs through the interstitium and interstitial fluid. Therefore, preventing narrowing of the vascular lumen and thrombus formation in larger vascular channels is crucial. Today, there is practically no alternative to Actividan, as most prescribed medications for patients, such as valritegral, ZIL, and others, have numerous contraindications. In contrast, Actividan are extremely well tolerated, having few contraindications. They can control the coagulation and anticoagulation system without causing bleeding or pathological coagulation. Therefore, Actividan can be used in various conditions without the risk of significant side effects. Even in the early stages of anticoagulant treatment, it's recommended to be associated with Actividan, with regular monitoring of coagulation function to adjust the dose correctly. All tablet forms require clear and consistent medication adjustment. Therefore, if you start taking Actividan in the initial phase of anticoagulant prescription for you, then after 10 days, it is mandatory to check your blood coagulation. You may reduce medication doses and continue taking Actividan, which in itself will treat the pathology for which anticoagulants were prescribed. Practically, the state of the vascular channel, we understand that here, primarily, these complications of hypertension depend on it, as we discussed. Normally, if myocardial hypertrophy has already developed, then it is unlikely that the heart can do anything, but as with the uterus, hypertrophy is almost smooth in myocytes, not smooth in muscle tissue, but nevertheless there is a reduction in the size of the myocytes towards normal. There is a publication that indicates that the membrane potential of the myocardium is practically stabilized. The number of mitochondria increases by increasing the cellular area, which effectively contributes to the restoration of contractile activity. This, of course, will lead to a more correct contraction of the heart with a normal rhythm, as our rhythm conductors and conducting system are still supported, and the functioning of the pumping station of our human body, i.e., our heart, is improved. This is a kind of preventive measure against complications. Our Actividan must be taken for a long period of time, initially with increased doses to stop the vascular flow, nourish, and allow the restructuring of cardiomyocytes with the development of a normal number of mitochondria and other necessary processes. Being aware of the main functions of our Actividan, which include improving the functioning of differentiated cells with reversible changes, we can appreciate its benefits. In the case where a cell is already on the brink of death, our Actividan regulates the processes of apoptosis, allowing for the rapid destruction of the affected cell and the formation of new cell connections, without stimulating the development of scar changes. This is crucial to prevent the formation of microinfarctions in cases where irreversible changes have already occurred in the structure of the vessel walls or the heart. A recent study conducted in China with ACTIVIDAN has shown that ACTIVIDAN can help stabilize the membranes of cardiomyocytes in the area of the heart affected by infarction, while simultaneously preventing excessive development of connective tissue, which facilitates its recovery. Therefore, ACTIVIDAN can prolong the viability of the heart muscle. In conclusion, this information, although of a medical nature, is essential for understanding the benefits of ACTIVIDAN in treating cardiovascular conditions and other chronic conditions, such as arterial hypertension, which may be associated with them. We know the effect of our product ACTIVIDAN, which is antiviral, antibacterial, and antifungal. An important aspect is that aseptic inflammation caused by deposits of atherosclerotic plaques under the intimal layer of vessels can be reduced by our ACTIVIDAN. As mentioned in previous conferences, ACTIVIDAN has the ability to reduce inflammation. Even if it attracts leukocyte cells to acute foci of inflammation, this wave of leukocytes limits the spread of inflammation to healthy tissues and controls the humoral components of inflammation. Therefore, focal inflammatory areas are limited, and leukocytes are quickly eliminated, thereby reducing the body's losses in the inflammatory process. Tumor processes are also controlled, considering the changes in vessel walls that can lead to the formation of vascular tumors. ACTIVIDAN acts as an immunomodulator, interacting with cellular and humoral immunity. It is essential to ensure that we monitor our health, and in case of new symptoms, especially in relation to intense physical activities, it is important to be vigilant, especially in the warm season when high temperatures can increase the tendency to thrombosis. Maintaining a balanced diet rich in vitamins and minerals is crucial for managing arterial hypertension and combating oxidative stress that may contribute to its development. And of course, this is a healthy lifestyle, without which, practically, our ACTIVIDAN will not work fully. It will sustain you for a certain period, but if you stay inactive on the couch, consume unhealthy foods, and do not move, you risk developing obesity. Therefore, it is essential for everyone to have a proper diet, engage in regular physical exercise, get out in fresh air, and drink clean and pure water. Mineral water is beneficial, especially if you have affected mineral metabolism or have lost a large amount of fluids. A balanced diet, together with sufficient physical activity, at least walking, can help prevent arterial hypertension. If you are in an initial stage, monitor your blood pressure because any increase can have consequences. It is important to take care of yourself to maintain your health at an appropriate level. I wish you good health. See you next Thursday.